Just be right on this SI area. Good. This is our activator. Works great. We have a lot of patients that use it. It's just a different way of adjusting, but still gets great results. Hey everybody, it's Dr. Karsyn here at Sioux Center Chiropractic, and today we are going to adjust Carissa. This is Carissa's 5th appointment, I think, and we've just really been working with her through pregnancy first off, but just some hip pain and some neck pain, and I think we're getting there. We're decreasing her scores there, so we're making some progress, but she's getting adjusted every week, and then we are doing some rehab with her too to just support those adjustments. So we're going to get started with her today. We're going to watch how she moves, and then we're going to get her on her tummy and just feel how her spine's moving and get her adjusted. All right, Carissa, I will have you stand in front of me here, and we're going to start in your neck, just looking at that range of motion and seeing how we're progressing there, okay? Good. And the other way. Good. So you can see that it's still a little bit tricky for her at the end, but she had a massage this morning and is doing a lot better so far after that. So go ahead and look up and then chin all the way down to your chest. Good. And do those feel all right? A little sticky at the end? Yeah. Okay. All right. Now I'm going to have you go ahead and twist. Good. And I'm going to come behind you and look there. Good, so she's clearing that. I can see her front shoulder. Let's go the other way, Carissa. Good. And do those feel okay? Yeah. Yeah? Okay. All right, last one we're going to test here. I'm going to have you go ahead and touch your toes for me. Good. And that looks pretty easy. So I'll have her come on up. And we're going to go hands on her hips and go back. And do you feel much through that? Tight. So she usually feels a little bit of pinching and some tightness in the hips when she does extend like that. So that's also what we've been working on in the rehab side too. All right, so we're gonna get our table set up here for Carissa. She is pregnant, not huge yet, but we have been utilizing the pillow, so she's gonna climb there. Good. And we just always make sure that's comfy for them. Does that feel okay in there? And that headrest is good? Okay. All right, so I'm going to first just feel up her spine. I like to do it this way when we're doing pregnant patients, but usually we'll have them sit while we do this. Good. Feel a little tight in there. And then in her neck, we're usually treating this lower area in her CT junction. Good. Okay. All right, now we're going to test her hip restriction there and see if we can feel a difference from side to side. And I'm also just looking at the level of her hips, seeing if we're having a change there. And I can feel when I'm doing that, there's some more restriction on that left side, and then I also feel that. Do you feel that, Carissa, how that's a little tighter there than that right side? Yeah. Okay. So we're going to be real light with the adjustments today. We popped the table up, so we're going to get that set here. And we'll let it fall under her just to get the tension right. So we're not putting too much into her pelvis. All right. Just be right on this SI area. Good. We're going to do 3 in that area. Does that feel okay, Carissa? Okay. Good. One more here. Good. So that feels a little bit better. We're going to recheck with her leg restriction here. Does that feel all right, Carissa? Yep. Okay. All right, and now we're going to feel, we've been adjusting that TL junction with her. Good. All right, I'm going to pop it up one more here. Go ahead and take a breath in and let it all the way out. Good. Good. All right, and then just based off of Karissa's history, we used the activator in her neck area. There's a little bit of history of a car accident, so we're just being cautious with that for right now. So this is our activator. Works great. We have a lot of patients that use it. It's just a different way of adjusting, but still gets great results. I'm going to feel up here a little bit more. You feel that right there, Carissa? Mm-hmm. So she can feel, often when there's areas that are restricted, they'll feel that tenderness in that area. And again, that's just where we're going to adjust. Good. All right, Carissa, you can come on up. And then I'll have you just stand over there again. And let's see how that neck feels. So go side to side there. Good. Good. Does that feel all right? Yeah. Okay. How about if we go backwards again on those hands? A little bit better, a little less pinchy. Okay. All right. So we've been working with Carissa for about 4 weeks, and we've gone every week so far, just based on her schedule. We like to do treatment plans here. It just helps us get more on top of the problem and figure out the root cause. And just based on her schedule, that's what's been working. So I think today she was down in her pain scales, so we are going to space her out a little bit if that's all right with her, and just kind of support her throughout the rest of her pregnancy. So thanks for watching. Let us know if you have any questions. Leave comments. Thank you.